I do think that what the body can do is absolutely miraculous, but I also
Mhm.
think that there's, so much science behind it. And we look at this fluid wave we talked about, the primary respiratory mechanism that drives healing and that I listen to as an osteopath. This wave actually starts at conception, starts when the sperm meets the egg, and light, a spark of light is literally shown propagating like a fluid wave through the egg.
Yeah.
And then we see, the migration of cells, the death of cells, the division of cells, and it's all occurring amidst this fluid wave that continues until the organism dies.
Welcome to the Wellness Amazon podcast, where we talk about everything body, mind, and spirit, health, and wellness. No subject is taboo here, and we have fun peeling back all the layers. Let's do this. Welcome, everybody, to a new episode of the Wellness Amazon podcast. Today, with Dr. Robyn Young, my absolute favorite osteopath. Yes,
My
I am biased. And we're going to talk about exactly that. Osteopathy, what is it? What is it not? And why is it important, and especially important to me, and why more people need to know about that option in the medical field. Welcome, Dr. Young.
Thank you. I so appreciate you having me on, Melina. This is just an honor. And knowing that a lot of your listeners are like minded as you, I know they may appreciate the osteopathic approach, so I'm happy to explain it. I am Robyn Young, DO, so DO distinct from MD. It's Doctor of Osteopathic Medicine. I received my DO in 2012 from Toro University, California, which is in Vallejo. And I attended residency in Orlando at Advent Health East. I did a family medicine and neuromusculoskeletal osteopathic manipulative medicine residency. I know it's a mouthful. And after that, I obtained board certifications in both family medicine and neuromusculoskeletal medicine. So both of those are what I currently maintain my continual certification in. After I finished with my residency, I started at a very rapid-paced practice called River of Life Osteopathic in Ocoee, Florida, where I see approximately 21 patients a day, 4 to 5 days a week, doing osteopathic manipulative medicine specialty visits. And the way that I would explain my type of practice right now is like a non-surgical orthopedic, if you were to think of me in the traditional sense,
Hmm.
where if you came in, say with knee pain, whether it were new knee pain or chronic knee pain, I might take an approach that is a more kind of a more holistic approach before I send you off to engage in more potentially harmful interventions. So that is my background as a physician. I'm also currently honored to guest table train at the Osteopathic Medical School, which is in Winter Garden. It's called OCOM, Orlando College of Osteopathic Medicine, which was
Oh.
established 2 years ago. And I have table trained for both the first and second years there, teaching the osteopathic manipulative techniques, and we'll discuss what that terminology is. And then I also currently sit on the board of the Osteopathic Cranial Academy as just a regular member of the board of directors, helping to ensure the smooth operations of the Osteopathic Cranial Academy, which is an educational initiative to teach osteopathic cranial manipulative medicine techniques to osteopathic physicians and students around the nation and the world, actually. Uh,
Hmm.
yeah, so that's my background.
What's cranial for somebody who doesn't know?
Yeah, so cranial is definitely like a loaded topic to define, and it may be easier to discuss the basic principles, the core tenets of osteopathic medicine first. But cranial is just one of the techniques that we use in order to accomplish a treatment effect, a more neutralizing effect in our patients so that they can achieve greater health. And the core tenets of osteopathic medicine are that the body heals spontaneously, that structure and function are interrelated, that a person is composed of mind, body, and spirit, and all of these things equally contribute to who the person is. And the fourth tenet is that rational treatment applies the previous three principles. And the American Osteopathic Association, also known as the AOA as an acronym, coined these core tenets back in the 60s, and that they've sort of stayed with us through our time as osteopathic medical professionals in the US to offer that distinctive, autonomous difference between us and the MDs. But ever since we gained a unified accreditation system in 2020, it's been even more important to emphasize this distinctive difference between us and the MDs so that people know what they're getting into when they apply to DO residencies as graduate, postgraduate medical trainees, and vice versa.
Mhm.
So, cranial as a distinction is a type of very gentle technique where we feel something called the cranial rhythmic impulse, which is a gentle wave that courses through the body at approximately, 8 to 12 cycles per minute or so. It's a little different from respiration, and we actually have mechanically measured this cycling through the body back in the 50s or so. Viola Fryman, she put pickups on a patient's head and she tightened the pickups, and then she observed this wave distinctive from respiration. So we
Mhm.
know from a medical instrument standpoint that this is actually something that's there. And then since the instrument picked it up, our hands are likely to be able to pick up something like that too when astutely and very meticulously trained to do so. So we palpate the cranial rhythmic impulse, which is also known as the primary respiratory mechanism. This is driven by essentially cellular metabolism. So it's like a biological wave, a process wave that drives all of the processes in the cells and all of the cellular reactions in the body. And it's a fluid wave. And the PRM is composed of 5 different components that drive this wave. You have the articular, bony articulations of the cranium that drive this wave. You have the dural connections between the cranium and the sacrum. You have the fluid wave of the cerebrospinal fluid. You have the reciprocal tension membranes of the dural membranes between the bones and the brain. And that core link, that dural link between the cranium and sacrum, is what drives it through the whole body. So
Mhm.
these mechanical processes help us palpate this wave. And then we can utilize this wave as a sort of a tool to determine areas of the body that need to be treated. For instance, I'm not feeling the wave very well in the leg. So I'm going to go down to the leg and treat the leg until I feel that wave resume in my
Mhm.
palpatory sense. And so I'm a very cranial oriented osteopath, but to say that I'm like a cranial osteopath, I feel like every osteopathic physician who practices OMM should have some degree of ability to palpate these
Mhm.
tiny forces during their treatments. And so we should all be called cranial osteopaths, technically.
Wow. I want to pick on that back up later because I know that that alone is a huge subject.
Yes.
And feel really good about that, you're explaining it in a very scientific way, and it is science and it is proven. However, it's almost in that realm of, there's energy flowing through our bodies, and people to completely dismiss this a lot of times. But before we dive into that, in simple terms, what is osteopathy? Because osteopathic doctors, it's medical. It's still, it's a doctor I can go to. But why is it different from anything else Western medicine?
Yes, I love that question. What makes us distinct from the other forms of Western medicine? DOs have a way of referring to to MDs or non DO related medicine as allopathic medicine. It is not a derogatory term at all. It's just the term I'm going to use help make it distinctive between osteopathy and allopathic medicine, allopathic. But back in 1874, our founder of the osteopathic profession, A.T. Still, who had been a Civil War era surgeon, he unfortunately went through the loss of 4 of his children due to tuberculosis and was just grieving beyond, you could imagine how a parent would grieve. He, having been a Civil War era surgeon, he saw all of the components, all of the tools available as per the materia medica. in the mid 1800s, and he was not satisfied with all of those techniques. And he really, in 1874, specifically June 22nd, it said that he flung the banner to the breeze of osteopathy to create a distinctive form of medicine in the United States that could utilize hands-on treatment. And he called this sort of lightning bone setting, or at least this is the kind of person that he followed to learn these techniques. He followed somebody who would set bones, and he learned some of these techniques from this person. And then he applied those techniques with various principles that he was able to ascertain from his study of the human body, and then created what is now known as osteopathic medicine. And then we've kind of moved forward from then. The first osteopathic medical school in the 1880s was erected, called Kirksville in Missouri.
Mhm.
And then since then, we've had a number of osteopathic medical schools that have been started since then. I think it's probably close to around 50 or 60 at this point, if not more.
Wow.
And also since then, we've been able to gain practice rights and full practice privileges in 65 plus countries, I believe. And so there's not much of a distinction in terms of what we're able to do medically, because all osteopathic physicians have the ability, if they're residency trained, to perform surgeries and to prescribe medications and to do all of the things that MDs, allopathic physicians can do. But what really makes us distinct is this emphasis on hands-on care. If you
Mhm.
take the hands-on care and the osteopathic principles with hands-on care out of the osteopath, in my mind, it is still pretty allopathic. So it's really the major thing that allows our distinction is the principles behind which we utilize these techniques and the actual treatment techniques that we're using.
Mhm. Yeah.
Yeah. So it's definitely, one of those things. Allopathic physicians, they can train with DOs, they can learn our techniques, they can utilize them as well. But
Mhm.
those who really want to become what we call 10-fingered osteopaths will attend our DO schools, and they will be able to be exposed to these principles and practice from day one.
Mhm. That's amazing. Thank you
Yeah.
for explaining that, because I know that's hard to explain sometimes for people.
Yeah.
Because to me, it's like, kind of what you said, that bridge between the two things and the true holistic, right? And when we talk about holistic, we're talking about whole, seeing the person as a whole, just like what you said. There's what's your purpose in life? What's your character? What's your personality and your body and your bones and your energy? And it's all, it comes together, and not just this one thing that's important, which we usually see in the allopathic medicine.
That's exactly right. We're more likely as DOs, especially those of us who use our hands and have received that neuromusculoskeletal medicine distinction as a specialty. We are really working with mind, body, spirit all day long. We're entrenched in those core tenets that I discussed in the beginning, trying to find ways to, what AT still used to say, help to remove the obstructions to healing,
Mhm.
so that the natural healing process, which occurs spontaneously, can occur unobstructed.
Yeah, like it's supposed to.
Yes.
Yeah, that's what we're made designed. I always tell people we're magical beings. I mean, really, such an intricate machine that we have, and you don't need to work against it all the time.
No, there's really such, I would say those words of working against, I think that's what I want to harp on, is that when you go with the flow, that's what healing is about. It's about being intuitive and listening to what the body needs and receiving that information and then responding,
Mhm.
likewise. So, not just on my part, when I'm assessing the body and I'm feeling for problems,
Mhm.
structurally or functionally, I am trying to find the areas where if I were to change, for instance, this innominate, this hip that's rotated, how could I help this person's recurrent bladder infections
Mhm.
potentially? So I am removing the obstruction, following the ease of this person's healing process. And I also want to speak to when you said magic, because I do think that what the body can do is absolutely miraculous. But I also
Hmm.
think that there's, so much science behind it. And we look at this fluid wave we talked about, the primary respiratory mechanism that drives healing and that I listen to as an osteopath. Well, this wave actually starts at conception. It starts when the sperm meets the egg, and light, a spark of light, is literally shown propagating like a fluid wave through the egg.
Yeah.
And then we see, the migration of cells, the death of cells, the division of cells, and it's all occurring amidst this fluid wave that continues until the organism dies. And so if you think about how the organism is growing in the womb,
Hmm.
along with this fluid wave or driven by this fluid wave, and then the organism continues to heal and grow along this wave for the rest of their lives until they take their last breath. So, yeah.
Beautiful. Wow. What would you say? Maybe if you introduce yourself or people you meet people and they ask you what do you do for a living, you say, "Oh, I'm an osteopath." What's like the biggest misconception that you have to clear out when people hear osteopathy and you're like, "No, that's not it."
Yeah, I would say the biggest thing, which I think that most people have been to chiropractors, to be honest, because
Mm,
there's not a lot of us in the all of the United States right now. I think there's only about 150,000 total, and unless, if I find something different, I will tell you for your show notes after this, but there's not a lot of us, and of the numbers of us that currently practice, probably around 5% of us have my specific specialty.
mm,
So when people find out what I do, in terms of like the physicality of what they do, they think I'm a chiropractor,
mhm,
basically. So I have to explain what I know about chiropractic and how it's different from what I do. And now I think there's multiple ways to skin a cat. I don't wanna say that what I do is better. I wanna say that what I do is different.
mhm,
And I do have that medical background, and I have attended medical school residency, and I do integrate all of that knowledge into my care and treatment of patients. So that's, primarily the misconception that people have about what I do. When I
mhm,
say I'm an osteopathic physician, some people, especially those from other countries, think that I am a therapist because in
mm,
some other countries, DOs are actually not physicians.
mhm,
Even though we have full practice rights in around 65 countries currently, not all countries that have DOs have recognized physicians as
mhm,
DOs. Um, an example of a DO that would not be a physician is an Italian DO. Italian DOs, osteopaths in Italy, they have signed an agreement with the government to exist as a profession. They
okay,
pay certain fees in order to do so. But from what I understand, or this as of, I think, 2020 or so, this was still the case. So if it's changed,
mhm,
I feel free, anyone can correct me, but they were not recognized as even like a physical therapy like profession.
mhm,
And in some other countries, they're considered more physical therapists.
mhm,
In some countries, they can practice, but they're not recognized by the government as healthcare professionals. So there's a lot of variation in training. So it can be frustrating when when someone's talking to me and saying like, "Oh, your client's this," and I go, "Oh, well, you mean my patients actually, my
mhm,
patient." This because even though I'm not picking up my prescription pad every day and writing, for different types of narcotics or other types of
right,
medications, I am administering a treatment for a diagnosis. I'm not administering a therapy.
mhm. Yeah, it's probably the word osteo that people get hung up with because everybody thinks bones and skeletal
Yeah.
system, and that's where it stops for them. Yeah, which
Mm.
it's okay, ask questions and you shall get an answer and be corrected and be educated in it.
But it's so hard though, Also, my patients say that they have trouble explaining what I do, and
Mhm,
sometimes I do as well, because it can seem so esoteric when
mhm,
you're feeling. It depends on how well you feel, how acutely you can feel what people are doing in body work. But some
mhm,
people ask me, like, "Are you doing energy work? Are you doing Reiki? I can feel something. It's different than what I felt, when I'm working with the cranial mechanism, for
mhm.
instance." So it can be hard for those people when they have a profound treatment effect that really helps them. And then they go home and they talk to their family about, you got to try this. Oh, I don't know what she did, but I think it will help you. And
Yep,
then family member goes, but you're saying you don't know what she did. So I don't, I'm not sure if
yeah.
I trust that kind of thing.
It is hard because even when I go to you, every time is a little different, right? I mean, because we have different things we talk about and then we address different things and they need different things. But
Yes.
also I think just like chiropractors can be different. To me, I always look for a chiropractor who does not crack. I don't like cracking. I like the gentle manipulation better, which
Yeah.
also then in my eyes doesn't create a forever patient or a forever customer because the whole cracking thing is just like they even tell you, "Oh, you have to do this regularly." Okay. When I go to you, I know that I'm not being made into a forever paying consumer of osteopathy. I go to you and you are really do try to make me better. However, I have been to other osteopaths too. And
Hmm.
you are different because you have a broader spectrum of knowledge, I would say,
Mm.
right? And I know you're very humble, but hear me out. I swear it's true. Where that helps you, that always goes into your practice too. Because I might tell you something where you just have a nugget of wisdom and tell me about, are you supplementing with selenium? Yes. Well, that could actually cause the thing that you're describing. Maybe cycle in and out of your selenium. So it's like, oh, wait. And those are things where I'm telling people you can Google stuff all day long and your symptoms. Things like this you will never find on Google, ever, 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 ever. There are so many off script things or things that are not public knowledge about things that only someone like you, who also stays on their toes and keeps learning and keeps picking up the journals and keeps, changed science and new data and new things that come up and brings that into the practice, that's
Yeah.
hard to find. That is very hard to find.
I see my patients. I don't know if this is always the right thing, but I have an attachment to the outcome.
Mhm.
I see my patients as just, I would treat any patient like I'd treat a family member, honestly. And
Yeah.
so I want the very best for them. So I have just that motivation to stay on top of my medical knowledge. So I know sometimes what I'm working against in some ways, but sometimes what I'm working with, right? I mean, and then I stay on top of my osteopathic knowledge, and then I'm a pretty big consumer of other types of podcasts like yours, where
Mhm.
I'm listening to what are the conversations other people are having? What kinds of things can I listen to that will help me better my life and explore the mind, body, spirit so that I can engage in my own journey? And then I can inform others from my own journey. And
Mhm.
sometimes it's the best way to, help other people is to go through your own stuff and then learn from that and help others apply it to themselves when appropriate.
Mhm.
And thank you very much for seeing me and also sharing with the fact that being an effective osteopathic physician sometimes involves being resourceful and being able to connect patients to resources, even
Yeah.
if those resources are not coming directly from your office.
Yeah. And it's refreshing to go to someone who can look at you from a medical perspective, but not gaslight you at the same time. And this is especially speaking as a woman. We know women get gaslit way more often in physicians' offices than men. And
Hmm.
that's hard. That's really hard. Or I go to you because of a different problem, but you tell me, well, it might be this. It might be something totally different that's connected to that, right?
Hmm.
And I know I've had Brian Friedman was on the show a couple of times now. He's a yoga instructor, but he's much more than that. He is like the body whisperer, and it reminds me of you, and then I had a pain episode just not long ago, and she did the same thing. And they both and you say, sometimes, let's say you have a back problem, you go to the doctor, you are a back. That's all we're going to look at. The problem has to be in the back, there where your pain is. But
Mhm.
then there's these really smart people like you and Brian and Eileen who look at people and say, no, it's not a back problem. It's actually from your hips, or let's look at your ankles, or, because everything is stacked together and you have to work with the body that way. And yeah.
Yes, I'm so, like, passionate about this, and this is, I love that you compared me to him because that's a huge compliment. I mean, you can see from the way someone's sitting, you can see from how they're walking, how they lay on the table. I always explain to students that come and rotate with me, look at the lines in the clothing. How are the clothing, that they're wearing, how is that being pulled? If we pick up the legs, we do a little jiggle. How is the fascia moving? What feels like the fluid wave that you induce is moving through clearly, very smoothly. And what part of the body does it feel like it's maybe being stuck in? And we'll go to that spot first.
Mhm.
And even though if the person said, well, I'm having right ear pain or like right shoulder pain, but yes, like that left hip is problematic. And we can actually see a fascial pull or restriction coming straight from that right shoulder or right jaw to the left hip. And the body wants to keep the eyes level while the body is walking. And so we need to not just treat what we call the chief complaint, but we need to treat the compensatory mechanisms. Otherwise, the issue is not going to be resolved. And then we also need to maybe treat the origin problem,
Mhm.
which could be in the hip, and we wouldn't know it unless we actually went there. So, yeah, it's very true. With the body, it's the whole body. It's not just a back. It's not just a hip. It's not just a knee. It's everything all together.
Mhm. Yeah. I recently learned that, especially with women, the pelvic floor and the jaw are connected. So most women that have a tight pelvic floor, they also have TMJ. And it's like, yeah, that makes sense. So sometimes getting a jaw or TMJ massage can relieve some tight hips too. It's so crazy.
Isn't that amazing? Yes, both areas, the muscle in the jaw and the muscles in the pelvic floor, are areas that people tend to hold a lot of tension as well, just involuntarily. Many people clench the pelvic floor like they clench their jaws.
Mhm.
So sometimes we don't always know if it's the chicken or the egg,
Right.
Definitely addressing one can absolutely address the other. And when
Mhm.
we think, thinking about the bones, like the ball and socket joint, of the femur going into the innominate. So the innominate bone, the hip bone, is composed of three different parts that fuse together. And if you look at the mandible coming into the jaw joint, that temporomandibular joint there is shaped somewhat similarly to the ball and socket joint of the hip. The mandible comes in at an arthroidal and hinge joint, though, not a ball and socket joint. But, studying the mechanics of one can help lend to the study of the mechanics of the other. So it's very interesting. Yeah.
Mhm. And this is the kind of stuff that not a lot of people know. And then they cannot apply this. And then sometimes you get stuck in that loop where somebody just looks at your ankle that hurts and it's
Yeah.
not getting better. And you do all the things. And then you think you're a chronically hopeless patient and nothing's ever going to change until you go to Robin.
I just hope those people find us. Yes. But
Yep.
I also wanted to speak to the gaslighting because the thing is, like, nobody, like people who study for years and practice for years in the medical profession, no one wants to admit really, or it's not easy to admit that actually I don't know the answer to your problem. I don't know how to fix this in the
Mhm.
15 minutes that these administrators have given me for our appointment.
Mhm.
So, yes, a lot of people end up having their conditions and their problems and their questions brushed aside because the current medical model doesn't really give adequate space for people to have them addressed.
Yeah.
What I love about my practice is even though I only get 20 minutes for follow ups and I get 40 for new patients, we're talking the whole time. I have my hands on you. Yes. I mean, sometimes I need to focus, concentrate, depends on how, how the work is going, the hands-on body work. But, we can really dig into some of these things and come up with some of those resources you and I suggested, or even uncover something that just wasn't being looked at before that can help guide a person's trajectory and an investigative process going forward. In this type of medical environment, we all unfortunately need to be our own advocates when it
Mhm.
comes to that.
Yeah. And it's hard when you don't have the knowledge. And also, again, to the whole Googling things, people need to be aware that search machines are fed a certain thing that is just most common, and it learns that that's the answers you want to know. It doesn't give you the answers that you have from someone who is doing this for, I don't know, 20 plus years.
Yes.
And it is, I just want to pick this up what you just said. I really want to highlight this and say that very slow into the microphone so everybody can hear it. 40 minutes, 40 minutes for a first time appointment as a new patient with you. Unheard of in the medical field. Ever, ever, ever. Not even with a chiropractor. No, nobody takes 40. I remember the first time I went to you and they told me, well, yeah, it's a 40-minute appointment. I said, huh? What do you mean? And listening, active listening. Sometimes I know when you treat me and I'm on the table and you actually put your hands on me, your eyes are closed a lot of times, fully present. Show me a allopathic doctor who does that. We're all rushed. It's like bam, 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 which I understand. It's not always their choice, right? It's just how the system is set up like that.
Mhm.
But that alone is gold. To have someone listen to you, get to know you, really talk about your health history, really understand where you're coming from, and probably already getting a couple of answers within 10 minutes of you talking and them, you figuring me out and be like, I think I have an idea about XYZ. And it might not be something that I came for, but it just comes up.
I like having that amount of time. I love to be able to, when that door closes, what I tell people is that they are the most important person in my world in
Mhm.
those minutes we're together. I can be entirely present with that person, leave my own things behind, which sometimes I'm happy to do, and just be the fulcrum for that patient to speak, to cry, to heal, to move, and really induce some movement where there might have been some stagnancy in their healing process. I love this profession and having this ability to do this where I can be so present with people. And I describe it like being in the front seat in the theater of life. You
Mhm.
get to really be present in so many intimate and vulnerable moments that you can help people through. And I view it as an honor and privilege, really, not one to take for granted at all.
Yeah. And I had a friend who led me on to you and osteopathy in general. And I remember she went to you and said, this woman changed my life in 10 minutes because apparently she couldn't move her neck. And then there was something else where I'm trying to remember how she worded it, but she said, my liver was in the wrong spot. And Dr. Young readjusted that and my whole life changed. And I thought, I think I have to go to Dr. Young and see her and see what she could do for me. And my life completely changed because you gave me answers to questions I didn't even have. You said, I think I have ADHD. And I looked it up and I went down that path and was like, all the light bulbs went on. I was like, oh, I'm not completely crazy. Okay, great. That's fantastic. That's good to know. And then the whole Ehlers-Danlos syndrome. That answered questions of 40 years of life that have
Yeah.
never been answered that I just thought I'm just faulty. But now it's like, no, if we adjust life to this diagnosis, which isn't doomed, you're not doomed, you just have to adjust a couple of things,
Yes.
everything changed. Everything changed. And I was able to bring that into my yoga practice with Brian. And then Brian was able to be like, yeah, sure. Yeah, that's good to know. Here's the whole stability work we're doing, which he already does that, but now he knows even better with me. And it's the quality of life is matched. When you have someone who actually looks at you as a whole person and figures out little puzzle pieces here and there, and it comes together as this beautiful landscape picture, and you're like, "That's why. Okay."
Puzzle pieces, I love how you said that because that's how I view it. It's just so fun for me to work with people like this, and it's just been an honor too to be a part of your process. And I know you're giving me so much credit, but perhaps credit is only due where I can listen and absorb and then be a fulcrum and reflect, honestly.
Mm,
It's the patient doing their own reporting, their own honoring of their own journey and reflecting of their process that ultimately gets you where you need to be. So I like the fact that I have the tools that allow me to help direct and kind of connect and sort of help facilitate the healing process. But we are all on our own healing journeys, and we are all utilizing our own cranial rhythmic impulses and our own vitality and life forces all together. So really, the credit goes to you.
yeah. Well, if I think you giving people the floor and having that skill of that active listening and really, like what you said, you're in this room, we shut the door, it's all you. You're important. That opens people up. They start talking about themselves.
Hmm. Yeah.
What would you say is the most common thing of your patient pool that you see that is the reasoning that people actually go to you?
Well, I love this question because I think being family medicine trained too, you are just used to seeing patients from birth to death, basically. So
Mhm.
you see a 2-day old. In family medicine residency, you deliver this baby and then maybe follow them until they're 4 years old, and then maybe beyond that, when you're practicing. And then my oldest patient has been 102. So I think and so it depends. Like if I'm seeing a baby, the most common issue is probably torticollis. It's when the baby's head is stuck like this in a
Mhm.
side bending and rotational. And I am utilizing cranial manipulation techniques to help open up the occipitomastoid sutures, which are between the occiput and temporal bone that lead back into something called the jugular foramen, which might be compressing certain cranial nerves responsible, giving that a palsy and sort of a spastic like process to the muscles that it innervates, for instance. I do treat a lot of latch sucking issues in babies as well. And that can be
Mhm.
so many different things from compression in the back of the head, from uterine lie, from the position they were in the uterus, to maybe again trauma during birth delivery or tongue ties and various kind of mucosal issues that the baby was born with. Then looking further ahead to kids, we're still treating some of those palate dysfunctions. From maybe an inadequate suck or tongue lie. We're treating, a lot of children with ADHD, autism will come to our practice because those kids have a lot of sensory noise. So if
Yeah.
we can treat their bodies and tone down their sensory noise, it helps them focus and it helps to zero out and sort of treat the autonomic overdrive.
Mhm.
And then in teenagers, we get a lot of growth related growth spurts, muscles and bones trying to figure themselves out. We get a lot of sports injuries, hopefully not too many concussions, but we've seen that as well. And we treat concussions with cranial techniques too. And then in my adult populations, my young women, I do see quite a few young women with EDS and hypermobile spectrum disorders. And I think a lot of them have been referred to me from their friends and coworkers that have discovered, oh, what you have is similar to you should see Doctor Young. I've been posted on the EDS forums. And so sometimes
Mm.
your patients find you, right? So a lot of people will come to me with those related issues. On the male side, I get a lot of like reflux, gastritis. We do accept car accident injuries at our office. So sometimes we'll see whiplash and other
Yeah.
sports related injuries. And I treat seniors too, people who have COPD, degenerative arthritis, disc herniations, late stage hypermobility, scoliosis related
Mhm.
issues. I've got a woman who is currently coming to me with severe rheumatologic and autoimmune illness that she has a very severe illness, but she feels having this hands-on treatment helps to tone her autonomics so that it can give her the gas in the gas tank, if you will,
Mhm.
to heal herself, and I have a number of other patients that fall in that category of really severe autoimmune rheumatologic, needing some just toning down and healing touch, essentially. I have a couple patients that I know they just come to me because they want to talk. And that's okay too, because again, in osteopathy, we're mind, body, and spirit.
Mhm.
And all of these things are interrelated and coming from the same plane and feeding into each other. So I'm happy to remove obstructions if those are in the mind as well. So it's just a treasure. Every 20 minutes, something different coming in and being able to put the pieces of the puzzle together with one another.
Yeah. And it's amazing that you can also do that because again, you have somebody come in if it's not a new patient for 20 minutes and it's a whole they come in with a story, right? It's a whole storyline and it's almost like a riddle you're trying to connect all the dots and then 20 minutes are over and a new riddle's coming in and now you have to dive into that. So kudos to you for being able to switch that fast and still be 100% present because I know you do. Even when I come with my child, there's 2 people in the room now, and usually we have a double appointment, and when she's done off the table, now it's me. Now we gotta switch gears and think about what Melina's problems are instead of the kids' problems. It's like
Yeah, that I for that reason, I'm grateful for my own ADHD because sometimes I like to switch gears like that. I'm like, "Okay, let's do the next one." And, it keeps it really interesting to be able to have that many things that I'm exposed to every day. It's really a treasure to me to be able to help as many people as I can. So in a way, having this rapid of a practice is a blessing because then I can do that many things. I can learn from everyone I treat too, so I can apply what I've learned to the next patient. But yeah, if it was an especially heavy encounter, sometimes that is a little hard to kind of bounce back from. I had a patient who recently started telling me a story about her mother, and I didn't realize something inside myself was going to come out and sort of feel a little bit triggered by that. I lost my own mother at a very young age due to breast cancer, and listening to her story and how she was remembering her mom, and I had a resident in the room who I was teaching at the moment.
Mhm.
The resident was to my right. She was treating a shoulder and I was treating a hip. And this woman was speaking. And of course, we want to let her talk because sometimes the body holds on to trauma. Certain
Yes.
things come out while you're treating certain areas of the body. So let it flow. Let it flow. Don't interrupt anything. So I don't want to leave, but I've got tears streaming down my face. And I look at the resident and I just wink at her like, it's okay.
Right.
And we just keep going, but I did need to take a moment after that one, and there's been other cases. Life can be heavy,
Mhm.
especially these days, and I say mind, body, spirit, but there's also the global and there's the cultural, and it all, plays into
Mhm.
what my patients are experiencing, so I do need to take a moment sometimes, and I'm grateful that my patients are the kind of people who are um, giving of grace for when I do run late because they know if I'm addressing this with them, I've got to be doing it with other people too.
Right.
So, yeah.
And that's the beauty of compassion and empathy because you are so open and you have to be in order to do the work that you do with these energy meridians and with that flow and feeling things, you can have walls up, which means if the doors are open to have that connection, the door is open to other things too.
Mhm.
So, having I would hope that, yeah, all your patients have the understanding that that's okay and things happen.
Yeah, my patients know sometimes people stop themselves and they're like, "Oh, I'm so sorry. I'm starting to feel very deeply here." I'll say, please let it come out. You don't want your
Mhm.
body to hold on to that. There's a
Yeah.
reason we have emotion. It's so that, these things can sublimate and leave the body. And
Mhm.
I explain to people all the time, it's as simple. second law of thermodynamics about energy isn't created or destroyed, it just changes shape and form, you know. If this is something that's locked up inside you and releasing an emotion is going to be the thing that allows it to sublimate and leave, please do. Don't hold that
Yeah.
inside, you know. And if there's anything any kind of thing I'd want somebody listening to this to really take with them, it's you're okay to you know, have emotions and feelings and go somewhere and let them out. Don't hold on to it. Don't let it
Mhm.
fester and become illness. Especially since some of the time, what you'll realize is you're not even holding your own, you're holding your family members,
Mhm.
your child's, your partners, your neighbors, or something else. We can hold other people's stuff too. And then that can fester and become illness when within ourselves, especially if we're empathetic people.
Yeah. Your ancestors
Yeah, yeah. Yeah, yeah, yeah. There's that whole thing too.
inherited trauma. There's studies about it.
Yes, yes, yeah. I will say, you know, as somebody of Ashkenazi Jewish heritage, you
Mhm.
know, I have some inherited trauma. I've got family members who were impacted, you know, by the events in the early 1900s. And that is something that I am not afraid to share about. And I do feel like we still experience some collective trauma as a people
Yeah.
from those times.
Yeah. Yeah. I'm trying to remember in these studies, it took 3 generations
Yeah.
to have the trauma out of the DNA.
Wow.
Yeah.
I've not come across that study yet, but I definitely would like a link to that because,
Yeah.
yeah, I mean, and I think that like, you know, doing the work and working through that trauma is important too.
Mhm.
And I also want to say, you know, I feel like there's every group of people that I've treated, you can look back and see some degree of trauma embedded in their genetics. So, you know, another example is my Irish Americans, who
Mhm.
many of them came over they were sent over because of famines, and their
Mhm.
ancestors were separated from their families. And then when they got here, they faced massive prejudice. And you know, the African American community, which we know,
Right.
suffered from the effects of slavery and many other inherent systemic biases that sometimes still continue today. And you know, there's you know, so many other groups impacted, the Palestinian people, you know, and anyone pretty much with brown colored skin, you know, affected by inherent biases in the system and have also experienced their own degrees of trauma. So, trauma is definitely apparent in the tissues. It's
Mhm.
apparent in the tissue feel. And it's one of the things that I do feel like I get to move when I treat patients for long enough. We can
Mhm.
get through to those layers, especially if they're open to it and they want to have that work done.
Yeah. The issues is in your tissues. It's
Yes.
true. Mhm.
Yes,
Yeah.
yes, yeah.
Yeah. And it's important to have someone like you who then can have that relationship with her patients and to give them that safety so that they can trust, so that they can actually let go of emotions coming up or memories coming up or whatever is coming up when you work with the body. Because I wouldn't feel comfortable with everybody to start crying and talking about my mother. That takes a special human in the room to do that.
Yes, I hope that I embody, you know, the energy of somebody who's open and receiving of whatever comes in through my door. And I think that openness, that energy of, you know, I I giggled to myself only because when you walk in through my door, I literally see a baby. I see you as a
Mhm.
baby. And I think that mother-like presence is probably what helps people feel like, "She's fine, I can tell her what I need to tell her," you know, and
Yeah.
I know this is HIPAA protected, so it's not like she's gonna go and tell somebody else about it, you know?
Yeah.
So, yeah.
Absolutely. And people feel that too, that you don't judge, because sometimes, especially when we talk about the gaslighting thing, if I experience that with a physician, I'm not going to tell them everything
Yeah.
because, first of all, I know you probably don't care. And a second thing is, you're going to judge. you know, because if you have the balls to gaslight me, you're probably going to judge.
I feel like it's inconvenient. These things are inconvenient, right?
Hmm.
So they must just be crazy. That's what some people, "Oh,
Oh
no,
yeah.
just it's all in your head." I hate to say that. Not everybody works this way, but it's like, if this is something that's going to take me more than 15 minutes to try to figure out, it must not exist. And
Mhm,
there are some people who are like, if I can't throw a medicine at it, I'm done. Like, go to a therapist.
mhm,
That's how some people work.
mhm.
Yeah.
Yeah, yeah. Or a psychiatrist because they can also subscribe you some stuff.
Which
If,
psychiatrists are very needed. Sometimes
right,
that is helpful.
yes,
It depends on the situation. But
yes.
yeah, I agree. The whole thing about being blown off, it that it's really on the topic of being. It's medical trauma.
Mhm,
It helps. It does compose medical trauma for people to constantly be blown off and misdirected by their healthcare
yeah,
practitioners.
yeah. And like you said, we're not shooting anything down. Medicine is needed. If I have a broken leg or a heart attack, yeah, I'm not going to talk about the relationship to my mother with you. I want you to help me like right now in the ER. I want you to fix me and save my life or save my leg or whatever it is, right?
Seriously, tell me about when you were 3. I don't know.
Yes, it's all these things, right? We need psychiatrists for things that are really, really the illnesses of the mind and all these things.
Yeah.
But also, if I have a regular doctor appointment, I need someone to listen to me. That's when it what it all boils down to. Now, people are more familiar, obviously, with regular physicians, maybe chiropractors. That's a little bit what's more, I guess, normalized nowadays. And I know when I go to the chiropractor, I'm going to lay on this weird table and they're probably going to adjust me. I know when I go to the doctor, they're going to look at my mouth and in my ears and in my eyes and they're going to check my lungs and my heart. What can people expect when they go to an osteopath?
When you go to somebody who has my specific specialty, the neuromusculoskeletal medicine and osteopathic manipulative medicine, you can expect to first sit down and be asked, "What is your narrative?" Well, at least with me, I just want sit down. Okay, tell me what brings you in. You can speak as long as you want to. I'm not going to interrupt. When you're done, and some people are like, I don't even know where to start. So then I prompt and ask questions. Well, tell me what you're here specifically for. Like, is there a body pain? Is there this or that? Then we
Mhm,
can elaborate on that. So first we take a history. I go through a review of systems, which is like, okay, you've told me your history. What other factors impact this? And then what other things are going on with other systems in your body? We review medical history, surgical history, family, social history, all of these things, cultural history, anything that is relevant, spiritual history, whatever anyone wants to tell me and wherever the conversation goes. Then we go to the table and I perform a physical exam, which very much the first time is a lot like what you would get at a regular medical practice. And we'll do sometimes muscle testing and other, reflex testing, orthopedic tests as necessary. Then we'll do an osteopathic screening exam. I sometimes watch the patient walk. I look at their lateral load bearing mechanics. I look at their body their spine. I have them lay down and I do the little fascial jiggle that I talked about and
mhm,
see where everything is getting hung up. And I will also look at the lines in the clothing. Okay, here's the chief complaint. Here's what the patient looks like, and I will get straight to work. And my techniques tend to be more on the myofascial and fluid side. And the fascia is composed of 70 to 80% fluid anyway. So, this is why I induce fluid waves and I look at the body like it's got layers of an onion. And
mhm,
each layer is like a taut bed sheet with various twists in it that I can untwist and unwind with myofascial release techniques, cranial osteopathic manipulative medicine techniques, a technique called ligamentous articular strain and balanced ligamentous tension. And all of these treatment techniques then help to bring the patient towards a greater neutral line so that they can heal more efficiently once they leave. And I will sometimes leave the patient with a standing treatment to make sure that their load bearing line is reset. Because the thing is, I have a patient lay down for most of the treatment, but then they get up and what position are they in for most of
mhm.
the day, right? So I do make sure their head's on straight before they leave, especially if I feel like, we did a lot of cranial work and they could be a little bit dizzy or a little off kilter from a pelvis adjustment or something. So that's typically what you can expect. And then I will ask the patient to come back so I can reevaluate, treat again if needed. Most people for long issues that have been going on their whole lives, please give me 6 to 12 visits so you can start to see where this will head, you know?
Mhm.
And then for an acute issue, I might be able to get your hip back in place the first time,
Yeah.
And so it's really very different. It's not like a prescribed, oh, come twice per week for 6 to 8 weeks for this guaranteed. No, that's not how it works. It's a constant conversation and it's a healing process that each person uniquely engages in on their own.
Yeah. Yeah. That alone, like what you said with the next appointment, the follow-up appointment, to see what the patient is actually doing with what you told them either to do or to take or whatever labs, right? And I
Mhm.
see this with my husband who's a veteran, so he gets very bare minimum care, right? And I tell him all the time,
Way to
you
laugh, but it's so frustrating.
you need to go see Doctor Young. Um, they will try to give him a medication. And then my husband's like, "Okay, when do you want me back?" And they look at him like, "Well, next year for your checkup." And I'm
Yeah.
thinking, so you are giving someone a medication and you're not even checking in what that medication is doing. Is it working? Is it not working? Like, I remember we did my labs together
Yeah.
and you said you need this supplement, but come back in 4 weeks or 6 weeks or whatever so we can see if we're going to take labs again and compare and contrast because that's what you do. We learned that in third grade science. Compare and contrast, right? It's like, I mean,
It's check and recheck. That's also
mhm,
osteopathic treatment. We don't just treat something and leave it be. We have to recheck the diagnosis and make sure that it improved. And everyone should be doing that with labs too. And frankly, with any chronic condition that you're treating with medication, there's an appropriate interval through which we need to bring a patient back to make sure that they're okay with how did this medication makes them feel, and what kinds of side effects are coming up and what does the lab say about how your body's
mhm.
handling the medication? So, yeah.
You would think that that's common sense.
It should be, but it also brings to light another issue, which is the care of veterans in this country, which sometimes leaves a lot to be desired. And I think the physicians that are working at the VA have a lot of systemic issues that they face that really interfere with the quality of care. And so I don't want to pin it on the physicians at all. I wanna say it's a systemic issue that I
Yeah,
think could probably be addressed in many, many different angles.
yeah, yeah, absolutely. And it's like you
Yeah.
said, it's follow the money a lot of times, unfortunately.
Yeah.
Yeah.
That's true. So, I mean, somehow, my boss, the person who owns River of Life Osteopathic, Ronald William Taylor, who's also known as Billy Taylor, somehow he's been able to convince a lot of insurance companies, thankfully, that our preventive care is worth it. Who knows how many surgeries and other more expensive interventions we have saved the insurance companies from having to pay for. And I really wish other states would follow suit. I actually don't think there's any clinics that do what we do in California where they take insurance.
Yep.
So it's very, if more people did, I think we would save. There's studies that show we reduce length of hospital stay. We reduce medications that people need to use. We
Mhm.
increase patient satisfaction scores. And this is like in neonates, pediatrics, elderly,
Yeah.
we're talking different types of conditions like asthma attacks, pneumonia, post-op ileus, these are things that have been studied and reinforced for the last 20 years. So DOs save money.
Yeah, 100%. I mean, the preventative care alone that you do, because I know that in your care and with the answers you find from me, I can change my lifestyle way more tailored than before, where it was like, kind of like shooting in the dark a little bit and trying this and nothing worked. And it's like, well, you have this. Oh, okay. I can
Mhm.
even now it's to the point where I actually can Google things that are specific to what I have that Nobody would ever has ever you gotta understand, 40 years on this earth, no one ever figured this out. And I have been to chiropractors, to, um, osteosurgeons, to I mean, everything you can imagine. No one ever said, "You're very flexible. We should look into that." No, no.
And maybe the type of listening that these people were doing, whether it's chiropractics, sometimes people get into a flow and they just think, manipulate the joint. And I feel all sorts of joints every day. So what's the difference between this one and that one? Who knows
Right.
what they're thinking. For me, it's again, I think it's that whole picture that I'm just trained to kind of to address. What's the full picture for this patient? How do we get her out of a cycle
Uh-huh.
so she can move forward in the next phase of her healing journey? So a lot of the time it involves giving information. And
Uh-huh.
the more info a patient has and the more they start to know how their bodies sense, the more that they can then Google for themselves and advocate for their own care. So I do find patients coming to me for years will say, well, because I've interacted with you, I now know when this hurts, it's because of this, and I need to do this.
Uh-huh.
And if that doesn't work, I know what to look for. So people's, their sense of self-knowing, self-understanding, and honoring their own needs increases. And then just by giving little tidbits of information, and it's that dialogue that goes back and forth, patients can engage further on their own healing journey. So,
Yeah. Yeah. And people underestimate the symptoms that can occur from your body being out of alignment. And not just when I'm say body, I'm not just talking about bones. I'm talking about the entire system,
yeah.
organs, tendons, muscles, fascia, whatever. If it wouldn't have been for you, I probably would have been on a lifelong supply of antacids.
Mm.
But you said, "Hmm, your stomach is kind of where it's not supposed to be. Let me fix it." And you readjusted it. And I said to you, "How can I prevent this?" And you said, "Well, it's a lot of times it's slouching and sitting and it kind of like moves around a little bit." Wow. No heartburn after you adjust and put my stomach where it belongs to. Crazy. Right.
Hmm.
But also, yeah, it kind of makes sense that if it's not where it's supposed to be, it gets kinked. It's not functioning the way it's supposed to. So,
Absolutely.
how many people in this country are on antacids?
There are so many. It is a huge industry, and most people should not be on them chronically. It's actually known they're not made for chronic use.
Nope.
Yeah, and a lot of people, it's probably not in the right spot. Their stomach's not in the right spot. So, um, and the thing is, if you ask a GI physician, they're going to say no. you know, this stomach is probably in the right spot. There's
Right.
no sliding hernia. There's no hernia. It's not something that we've seen on any imaging,
Right.
but it's something I can feel because the esophagus is stuck in a certain way, and then it's easy to do the manipulation to change it.
Again, a lot of times it happens where I say, "Man, I could talk about this like 3 more hours," and I'm sure you feel the same way.
Any specific topics you want to, in the future, I'm so happy to come back on. If any of your viewers have specific questions they want to hear the osteopathic perspective to, I'm more than happy to prepare something and, we can have another conversation.
Absolutely, and, it was such a pleasure having you on. I can give just everything back to you, but that's the beauty about having someone where you feel good with. I haven't seen you in a while because I'm doing great. That's good.
Cheers.
And
Yes.
my kiddo's doing great too, and we had a lot of things, that we're doing now that you recommended where it just all comes together and it's a beautiful thing where someone is not making again a customer for life, but actually wants to help someone be better and have quality of life, and that's what you do. You have that compassion. The whole passion is really very evident in your practice, and I love what you do. I wish there was more of you out there, and that's why I'm telling everybody who's listening, go see an osteopath. Even if that's just a second opinion or if you're curious about it, it really is life-changing, and, thank you so much, Robin, for being on the show, taking the time out of your busy day to be here because I know you're a very, very busy woman, and, it was such a pleasure.
Thank you, thank you. If your viewers wanna find an osteopath, you could search on the Osteopathic Cranial Academy website. It's cranialacademy.org. There is a find a physician function there. You can also look at the American Academy of Osteopathy website. That's
Mhm.
abbreviated AAO. And you can search on that website as well for neuromusculoskeletal specialists, also called NMM or osteopathic manipulation OMM. And you might be able to find somebody close to you. I'm hoping. We're like
Yeah.
unicorns, but hopefully.
Yes, I'm sure. And even if you have to drive 30 minutes, it's well worth it, in my opinion. So, all
Thank you.
right. Thank you so much. I do want to have you back on the show for all the cranial things we talked about because I think
Yeah,
that's a subject on itself. And
absolutely it is.
yeah, yeah. I hope everybody had a good time listening and got a nugget of this. And we're good. All right, Robin. Have a have a wonderful Sunday. Bye. Thank you so much for being here with me today. Leave a comment, give it a thumbs up, a review, and share it with somebody you think needs this. Have a fabulous day. See you next time.